I'd like to talk about spine surgery recovery from the perspective of being a physical therapist. I've worked on thousands of patients that have had spine surgery, and now I've had spine surgery just a month ago myself. I had this injury for 2 years, and I herniated discs to the left side in my low back, lumbar number 4 vertebrae and lumbar number 5 vertebrae, and then lumbar 5 to the sacral 1 vertebrae. So 2 discs essentially pushing against nerves on my left side, leading into my left leg, causing buzzing and a sensation of gas bubbles or tiny miniature bees flying around my foot. I'm a cyclist and a runner and a swimmer, and also a father of a 2-year-old. And I had surgery a month ago. The first week was certainly the hardest. In the first 2 days, I needed to take a number of stool softeners. I had issues of pain and severe constipation, so be careful with that. I do recommend that people go ahead and purchase, even if it's only for a week or two, a long reacher grabber to pick items off the floor so they don't have to bend over. I think I would have used a raised toilet seat. Even being a young man, I would have used a raised toilet seat for the first week and a half. I think there's probably a place for a long handle brush to wash your feet, and I think that would make things easier, certainly, to be more considerate of your spine. The first week I spent a lot of time on a very thin ice pack on a flat, firm surface on my bed. I would get up and do some light housekeeping, wash a few dishes, dry. I could pick up items around the house, children's toys, with my long reacher grabber, and I would be up for an hour, and then I would lay down for an hour, and that seemed to work quite well that first week. Second week was a little easier, although I spent still a lot of time on the ice pack, and I thought that I would be walking more, but I think each person is their own individual, and my understanding is that anterior neck surgery is a quicker, easier recovery than posterior or rearward neck surgery, and then low back surgery, because of all the weight of your upper body on top of your low back, is harder. So you shouldn't compare necessarily your low back surgery versus that of a neck surgery that just has the weight of your head. I think the ice and occasional ibuprofen, although I understand the ibuprofen can slow how quickly your bone heals. By the third week, I felt like I could begin to start driving short distances, 15 minutes to the store for a few items, or to drop my son off at preschool, run some simple errands. But I was quick to get home and lay again down on the ice pack. Of course, you're not supposed to bend at the waist, not supposed to lift more than 5 or 10 pounds, and not supposed to twist, and I found the reacher grabber to be very helpful in that. It's been a month now. I'm limiting myself to walking about a mile. I find that the mechanics of my walking suffers greatly as the pain comes in after that first mile, and most of the actual bone healing, occurs in the first 6 to 8 weeks, so that's 2 months for the actual bone healing. The soft tissue, because of blood supply, takes longer, and it takes up to 4 months for the hole that the surgeon had to make in your disc to heal over, to patch itself. So in my case, I had a disc that was herniated or pushing out against a nerve at lumbar 4 and lumbar 5 to the left side, and they remove a third of that disc, although it's called a microdiscectomy. In fact, they only remove about 25% of that rearward disc material pushing on the nerve. And then at L5, lumbar 5, and S1, sacral 1, I had a herniated disc, but more scar tissue from a torn piece of annulus, so they're wrapping around the disc. And so they had to remove scar tissue in that area, and then also open up a bigger bony tunnel called a foraminotomy. Essentially, you can imagine visualizing like a Dremel tool or nipping away at a bone where the nerve exits into your foot or your leg. And higher at the L4 and L5, again taking the disc out, but then also taking some of the bone in sort of a modified, what they call hemi-laminectomy. Essentially, you can imagine taking part of the hood off the engine to give the engine more breathing room, and so that's essentially what I've had. I think if your job is extremely physical, like mine, where you're lifting and twisting, then you should consider going back to work at full capacity after 4 months. If your job is more lighter duty, then it may make sense to go back to work at the 2-month time frame. And again, of course, you're consulting with your doctor and your physical therapist and whoever helping you to get you back on your feet. Thank you very much.